Common question that I get just if I'm out in the community is, oh, I've got this pink eye, or I got pink eye last year. Do I need to come see you for that? The simple answer is yes. You need to see some kind of eye care professional anytime you feel like you're experiencing red eyes or pink eyes. The reason being is you can operate with a very educated Google guess, but you might end up barking up the wrong tree. There's a lot of conditions that can mimic one another if you're looking at the condition with the naked eye. We use special equipment, including a special dye that we might instill in your eye. We use a special piece of equipment called a slit lamp that will look up close at microscopic cells within your eyes to see that we're getting on the right track in terms of diagnosis, and of course that's going to guide the treatment. So one common example is the pink eye that everybody talks about is the really contagious one, and it's actually not that common. A more common type of red eye would be a dry eye, and the dry eye is going to be treated very differently than an infected eye. An infected eye is going to be treated very, very differently than an eye that's red from allergies. And an eye that's red from allergies is going to be treated very differently from an eye that has an inflammation called uveitis or iritis. So those are 5 very common types of red eyes that we get into our office, but again, they're all treated extremely differently based on what we see in the slit lamp. So it's very important, especially if you have a chronic red eye, to get your eyes checked by an eye care professional. At Family Eye Care Center of Atlanta, we are very concerned with getting to the bottom of your diagnosis. We like to find out the root cause. Sometimes that root cause can have something to do with your diet. Sometimes the root cause could have something to do with how you're wearing your contact lenses. Obviously, if the root cause is something like dry eye, we want to treat the problem. We don't want to just treat the symptoms so that you're going to have long-term relief. Again, at Family Eye Care Center of Atlanta, our goal is long-term, comfortable, functional care. And we apply that concept to every patient that comes into the office, including our patients that come in because they have a red or a pink eye.